Hi everyone, Kay Bergner here today with Dr. Tom Phelan, author and creator of 123 Magic, as well as the author of The Manager Mom Epidemic. Dr. Phelan, welcome.
Good morning, Kay.
How are you today?
I'm doing pretty good. Seeing a light at the end of the tunnel on the COVID situation, I think.
Yeah, yes, lots of new things happening. It seems like there's been a lot of movement lately, so that's great. I'm sure a lot of people will be relieved to try to reclaim some sense of normalcy pretty soon.
Well, we could use it.
Yeah, absolutely. So today we are going to be talking about social anxiety disorder. Last week we chatted a little bit about kind of what social anxiety disorder is, how it differs from just general shyness, how and when it might show up in adults and kids. And actually, Dr. Phelan is going to be teaching a free seminar on that tomorrow. So I will drop the registration link into the comments of this video after we're done here. So what we're talking about today is actually part 2 of that. We're talking about what treatment options might be. And actually, Dr. Phelan will be doing a seminar on that next week. And I will also drop the registration link for that in the comments of this video as well. So Dr. Phelan, we talked about social anxiety disorder. Can you remind us of some of the ways that that can show up in daily life, some of the challenges that that can cause?
Yeah, you want to remember the social anxiety disorder, or social phobia, what they call it, is really an anxiety related to other people, where a person, say, will get in a situation with other people and all of a sudden feel like he or she is performing, even though it's only a conversation or eating lunch with somebody. It could be a performance, it could be a musical performance, but the anxiety then gets out of hand and the anxiety starts interfering with the performance, and the person who's going through this will feel very upset, very anxious, panicky, and so on. And after a few rounds of that, once it's started in your life, what happens is that you either you become an endurer or an avoider. And an endurer is a person who puts up with these situations, say at work when you got to make presentations or something like that, or even talk to people in the hall. You put up with it as best you can, but you don't like it. And avoiders, and this is more impairing, avoiders may give up that job or give up a promotion because it involves public speaking and stuff like that. So it can really constrict or restrict the boundaries of your life in ways that can be very depressing.
Absolutely. So if you have social anxiety disorder or social phobia, you mentioned there are endurers who sound like they kind of just live with it, but maybe are pretty uncomfortable a lot of the time. Um, and avoiders where it really is impacting their life in very material ways. If you have social phobia, do you just have to kind of live this way and put up with it? Do you just have to accept it?
Yeah, no, I mean, that's the good news. And that was coming there. It's one of the most treatable problems that there is. And so we do have very effective treatments for it. The one of the biggest problems is, in order to get treatment for it, you have to go in to and talk to a person, which scares you right away, and tell them about your major weakness in your life, which also scares you. So it's kind of a rough start, but it can be dealt with very successfully. And I've dealt with lots and lots of people. You imagine over the years being a clinical psychologist who have had this kind of problem. And I love working with them. I mean, it is fascinating. You can do so much good. You can make so many changes that it's a very rewarding experience.
Absolutely. And I do want to get to talking about the finding of a therapist and what that might look like in just a minute. But before we get there, can you tell us what the Yerkes-Dodson law is and how that applies here?
Yeah, this one, it sounds kind of strange. You say Yerkes-Dodson law, and if I told you it was created in 1908, that would make it sound even stranger. But it's something anybody who's had social anxiety or social phobia or performance anxiety knows what it is. It describes the relationship between your anxiety level and your performance. So, our brothers and sisters in the social anxiety world are musicians. Musicians feel performance anxiety a lot. And so the Yerkes-Dodson thing is that as your anxiety goes up in the beginning, your performance will get better up to a point. And then if you have too much anxiety, you'll start disintegrating and your performance will fall apart. And of course, this is the heart of social anxiety, the worry that I'm going to fall apart in a social situation or not be able to do what I'm doing. So it's like anxiety and arousal, good up to a point. Too much of it, not good.
Got it. And you have actually had some personal experience with social phobias. I understand that you're going to be talking about some of that in the seminar. How are you feeling about that?
I knew you had to bring this up, but yeah. Well, it's a little bit of both. I mean, to have had experience with it most of my adult life, it's been it's embarrassing to talk about. To be honest, it's a weakness. It's not a strength. But that means I've also had a lot of personal experience in dealing with it, as well as helping other people deal with it. So I think I've got a lot to say about the different treatments and about the outcome and what the process feels like and so on, because I've been through it.
Yeah, and I think it's so helpful to hear from someone who understands it not just on a conceptual level, but on a very personal level as well.
Right.
Okay, so you mentioned that this is very, very treatable, but in order to treat it, you have to find a therapist. And in order to find a therapist, you have to call up a doctor and talk about this, who is a stranger, and an authoritative one. And you have to talk about something that is a problem in your life, something that you're not proud of. How do you get past that in order to kind of get the treatment and the help that you need?
Yeah, well, you first have to have a sense of hope, and what we talk about later will hopefully develop or provide some reason to hope about this. And then what you've got to do is you got to do a little searching. Now these days, therapists have their own websites and stuff, so you can search on websites and you can look at people and so on. Word of mouth is always better. So if you know friends who have been through this, or you have a doctor that you like, it could be your family doctor, your personal doctor, and ask them, well, who do you know that's a psychologist, counselor, social worker, whatever, that could help me with this? And then you can start doing some searching around and see. But you have to realize that the search for the doctor is going to hit right at the heart of the problem itself. So you're going to be scared. You're going to not feel good about it. But that's where you have to start. People say, what about a psychiatrist? You may need to see a psychiatrist if medication is going to be involved. The problem with the psychiatrist is that they don't have time anymore to do the counseling or the psychotherapy, and you may need both. So if you go to a psychiatrist only, you're more likely to load in the medication direction, which can be very, very helpful. But I think you want to shoot for a psychologist, a clinical social worker, a certified counselor, something like that. And then, and then again, this hits you right where you live, but you might want to call these people and talk to them on the phone a little bit, have a list of 5 questions. How do you operate? Do you deal with social anxiety? How do you deal with it? And get a feel for how they operate. And if they don't want to talk to you on the phone, the heck with them, go find somebody else.
That's that's good. I like that. That's good advice, and it's something that I think is useful for someone who has this type of anxiety to hear, because there's already going to be this concern around, like, oh, am I going to do this wrong? So you don't need to be working with someone who is not willing to help address your concerns and make you feel more comfortable.
Yes, and I've told patients for years, and this is hard for especially social anxiety people, I say you want to look at a doctor as a servant whom you hire to do what you want. And they'll look, what are you talking about? I look at him as a god to tell me what to do. No, no, no. We need a new point of view.
Yeah, absolutely. So, assuming that we are able to get past the anxiety of finding the doctor, and we've found a therapist, what type of therapies are going to be helpful with social anxiety disorder?
Well, there are really several. One is what we call cognitive therapy. The social anxiety disorder is really based on, it may be based on an overactive amygdala, hypothalamus, and adrenaline system, but it's also based on screwy thoughts. And the screwy thoughts have to do with feeling that people are watching you. I mean, this isn't psychotic, it's normal. People watching you, they're evaluating your performance and that kind of thing. And I teach people what I call the law of indifference, and that nobody else in the world really has the time, interest, or energy to worry much about what you're doing. But you really have to learn, how does that affect your life, and how does it affect you and the different people you interact with? Another major part of the dealing with the problem is practice. Practice, practice, practice lowers anxiety levels, builds skills, and so on. And a third element in the treatment plan can involve medication. And I find that a lot of people, non-psychiatric mental health professionals, as well as lay people in the population, have a lot of prejudice against medication. And that's too bad, because it can be very helpful.
Yeah. So talk to us a little bit about, you mentioned cognitive therapy, cognitive behavioral therapy for someone who might be anxious about going in and starting something like that. Can you describe a little bit more what that might involve?
Yeah, part of it, if you look at it from the self-esteem point of view, which we talked about last time, I think, if you have the social anxiety, your self-esteem may be pretty low, and you may have a belief that other people aren't going to want to talk to you or aren't going to be interested in you and so on. So as your therapist, you and I are going to agree that you're going to go talk to some people and you're going to see what kind of response you get. And I'm going to help you if you need the help, what to say, how to ask questions, how to be nice and so on. And so we're going to do cognitive behavioral. The cognitive is you're going to think, maybe I do have more to offer. Maybe I am more of a interesting person or worthwhile person than what I feel. And maybe these other people will appreciate it. Now let's go see if that's really true. And so you can see this is going to be an anxiety provoking experience. But what usually happens is that these people do have a lot more to offer because your self-esteem with social anxiety is so low that you can't see yourself or the world realistically. And so my job as your therapist is to help you see yourself realistically and do something about it.
Yeah, absolutely. So, how can you motivate someone to face a problem that causes severe anxiety? You say we're going to discuss that this is what you think and then this is how you're going to go and practice it, but that's the exact thing that I don't want to do. How are you as the therapist, or how are you as a person who experiences that anxiety? How do you motivate someone to deal with that problem?
Yeah, I think you have to do a few things. One is you have to let them know that you understand what they're talking about and that this is not an unusual problem at all. One of the things about social anxiety is an extreme feeling of loneliness. And the loneliness has to do with you think, I'm the only one that's weird like this. I'm the only one that has this problem. And just about everybody that has severe social anxiety is going to feel like that. They see the outsides of everybody else. They don't see their inside. So we have to, teach them that this is how it works. We have to teach them that we can understand their problem. And then we have to tell them that, in my experience, working with other patients and so on, and from the research and everything shows that this can be dealt with. Imagine yourself taking that promotion at work. Imagine yourself calling a girl for a date. Imagine yourself doing this, that, or the other thing. And so we have to sell them hope. And so we toss it out and then see what kind of reaction we get and see if we're getting anywhere, because the journey has to start with a sense that it can be done, and a sense of hope that yeah, I can, as bad as this is, I can get over it.
Yeah, and you were kind of sharing that from, say, the therapist point of view, speaking with an adult who has this problem. But as you were talking about that, it made me think this actually, what you advise actually sounds very similar to the sympathetic listening that a parent might do with a child.
Exactly right. Exactly right. And if you're a therapist, that's the first thing you have to do as soon as somebody walks in your office is sympathetic listen. And that by itself, it's a bonding experience. That person will then bond to you, but they'll also get a reassuring feeling that you know what they're talking about. And oh my goodness, maybe I'm not so weird. Maybe this is a more common problem. Maybe I do have a lot of brothers and sisters in the general population that share my difficulty. And you're right, the active listening or sympathetic listening is the road to take that first step.
Absolutely. So whether you're a therapist working with adults or whether you're a parent who has kids who seem to be experiencing anxiety around social situations, that sympathetic listening is really a great first step.
Thanks, Jay.